So these are the top 4 hair transplant snake oil marketing terms that seem to come up over and over again. There's probably no ill intent behind them. As long as they're not putting the patient at risk, I think you're fine. But at the same time, I think a couple of these are a little bit misleading. So I'll kind of take you through what the meanings I think are, or what you should really expect. So the first snake oil term is painless. Everyone says it's a painless procedure. And that's actually should always be true. It should always be a painless procedure, but it will never be a painless procedure. Let me explain. Before doing any kind of hair transplant surgery, FUE, FUT, anything that anyone's ever invented, DHI, safe, smart, U-graft, precision graft, IntelliCheck technology, whatever it is, they have to numb you. Why do they have to numb you? Because you're going to pierce the dermis or pierce the skin of the patient in order to remove the follicle. Now, even if I don't pierce the skin and I literally just pull the hair out of your head, that's going to hurt like crazy, right? Unless someone numbs you up beforehand. And that said, if you are numbed properly, which takes injections, you use a needle and you inject them and put numbing fluid, and then the transplant, no matter what kind, should be completely painless, because once you're numbed, you'll feel nothing. I mean, I've had some crazy stuff. You can take somebody's heart out of their own body, and if you numb them up good enough, they won't feel anything. So at the same time, the procedure should be painless, but there will be pain from the numbing. Now, the only other part I can think of in regard to this is after the procedure, right? If there's any pain after the procedure. Now, what would you say? I know from my procedures that I really had very little to no pain. I know my last procedure, the third and final one that I've done, there was no pain afterward. But at the same time, there was some uncomfortable feelings because I had stitches. I got a strip procedure, so things started to itch a little bit after a while. But I didn't actually have any physical pain, and I didn't even take my pain medication. So what do you see with patients? Are most of the top surgeons, you're not really feeling much afterwards as well, or does it vary patient to patient, or yeah?
It's, for the most part, for most patients, if you're seeing a specialist and he's a really good surgeon, and obviously he's not going to be doing what he's doing if he's not a really good surgeon, it should feel like a little bit of a superficial wound. I mean, it's going to feel tight, and there's some fluids used that are going to expand the tissue a little bit. So it's not exactly the most comfortable feeling, but definitely not deep tissue pain.
Yeah.
If you've got a doctor who's a hack, then you could expect deep tissue pain, and that's going to require pain medication and whatnot. So that's not fun. Okay. Yeah. But let's just go back to talking about the top surgeons, because that's who we like to talk about. And you do have your occasional guy who goes in there that's maybe a younger guy, that's maybe like the big muscle guy that thinks he's the toughest guy, and not so tough. Those are the guys that are afraid of the needles. And you'll have I call them like maybe a crybaby or two. In all fairness to them,
is that from the needles?
Well, I'm talking about they're too uptight. They're just uptight, and I'm not being specific post-operatively like you asked. So, for the most part, if it's done right, you should really have not much discomfort at all. But sometimes guys get so worked up because they're so scared and they're so afraid that it's more they're their own worst enemy. Gotcha. So those are the guys that may think that it's a little bit more intense than it is, but by today's standards, it's really not that bad at all. Once once that numbing is done, and then post-operatively, if you have some tightness the first night, that first night will always be the worst. It'll be 100 times better the next day, and then it's just a matter of kind of getting through the recovery period of a couple days. But FUE, that's one advantage FUE has. But as far as a linear procedure goes, if it's done right, it really is not that big a deal.
And an FUE procedure, you're not gonna won't have the tightness, obviously, but you still have to get numbed up. So I guess that's the main thing. Most of the FUE procedures, they say this is a painless procedure because it's this FUE. But yeah, you have to get numb either way. And that's going to be the main pain regardless.
Yeah, and keep in mind that, when we do FUE, we're doing a larger area, which requires more numbing. Now, doctors that are really good are going to do a block, so that you're going to feel maybe a little stick at the top, a little stick at the bottom, and maybe a few on the sides, and they block the entire area. Then you're not going to really feel the rest of them. But just so that the consumer or the patient knows, there's a lot more lidocaine needed and a lot more injections for FUE than there is the other procedure, the linear procedure. Yeah.
The second term is non-invasive. This is a really popular term, and it's kind of similar to the painless aspect, where this doesn't really make sense. What is non-invasive? To me, non-invasive would be anything where they don't pierce your skin. I would think that even Botox is invasive, isn't it? Because they put an injection in your face. I mean, to me, that's pretty invasive, but it's not. That to me, I don't know. If somebody injects my face, that's invasive.
This is interesting. Yes, this question, David, because there's a lot more to it than you think. It is what you think. It is invasive to a certain degree when you pierce the skin.
Yeah.
That has to be done by a licensed medical professional. All right. Now, under the supervision of a doctor, a nurse practitioner, or a physician's assistant can do that. But we're talking about having to have a license to do that. I hope I'm not going down this path in this way, or I hope I'm wrong about this, but there's a lot of clinics out there that we talk about that really aren't hair transplant clinics. They're not specialists. They don't do this. And they're trying to kind of sales pitch, or they're trying to lay out the format that this is not an invasive procedure, so a doctor's not required.
Okay, gotcha.
So that is a problem, and that's for a whole nother video.
The other thing is, with any kind of hair transplant, you have to extract hair from your body and extract some amount of tissue to support that hair. So I just don't see how taking a piece of your body out, and potentially thousands of small little pieces of your body out of your head is non-invasive. But it's a really common term that's used across all sales websites for hair transplants, it seems like.
From a technical perspective, if you kind of think about it this way, right? There's a gland underneath each hair follicle. It's called the sebaceous gland. Mm-hmm. Okay. Below that is the nerves, veins, and arteries. I mean, there's small nerves all around it because that's how we feel pain and all that. But the sebaceous gland is kind of the kind of fatty tissue that is imperative for these grafts to grow. So you need to get enough sebaceous gland. But at the same time, if you go too low because you're afraid you're not getting enough sebaceous gland, you can get into the veins and arteries. Mm-hmm. So I think that because I'm giving these guys the benefit of the doubt, but when they're talking non-invasive, the better doctors, the specialists, they're not even using any need for any machines to cauterize. There's no real bleeding. There's really not. So to them, when you're talking about, taking out an organ or doing heart surgery, that's invasive surgery.
Yeah.
When we're talking about taking out a strip of tissue, although some of the videos out there that show taking out a strip looks pretty invasive, it's not so much. So actually, it's compared to what? Cutting off a leg?
Yeah, you're right. Yeah, non-invasive.
Exactly. So non-invasive meaning that when you're doing this every day and you're really good at it, there's not a lot of bleeding and it's pretty easy to do because you're so good at it. I guess it could be called non-invasive.
The third thing that I see a lot is more of a sign, a snake oil sign, than it is a actual term. And that is that they're advertising the clinics or the type of procedure that they do rather than their surgeons and their surgeons' experience. So the things that I see are, we have this special machine. We have this special tool that enables anyone that we train in our facility, and who knows how much training they did. They could have gone and spent a day with a doctor. So one doctor spends another day with another doctor, and suddenly he's just the same. He's just as good at doing hair transplants as the other guy who's been doing it for 5 or 10 years and has gone through, what do they call it when a surgeon spends a year or two, a fellowship with another hair transplant surgeon, which is very common among, I would say, most specialists go through some kind of,
at least a year,
long-term specialist.
With not a lot of pay.
Yeah, that's an intense schooling to go through that really turns people into a specialist. And you won't see anything about that on most of the sites that are selling hair transplants. Instead, it's we have this system. This is the brand new technology. And you're like, well, who's operating this? And they'll try and tell you it doesn't really matter. Or if it does matter at all, well, don't worry. We have a special schooling. It doesn't tell you how long they spend in this school, how many surgical procedures they go through, anything like that, how well they can close wounds, nothing. It just tells you, they went to some schooling. To me, if I see that it would make me want to run, because I would think, I want to know who's actually doing this and what their experience is.
I think that what you're talking about, David, is what I've been talking about for a long time. And basically, so that the consumer understands what's going on. Initially, about 10, 15 years ago, when FUE started to make its tracks a little bit and make its way into the industry, and Europe was already up and running, they never even did the strip. These biotech companies got involved in a $2 billion industry. So what happened was they started out with, the biotech companies, meaning the medical device companies, wanted to sell these machines that basically do FUE or help you do FUE. And you know all the players, the NeoGraft, the SmartGraft, the Artist, and all that. So what they intended to do, and I give anybody credit that intends to do something, is they went out to the hair transplant doctors that do this full time and offered their machines. Unfortunately, since this is kind of like the surfboard manufacturing industry, it's not a real big industry. It really isn't compared to making tires for your car. So they kind of ran out of steam and realized that this wasn't a big of a moneymaker for them. So now if you open up the market to the plastic surgeons, the cosmetic surgeons, the med spas, wow, there's a lot of those. And if you do Botox, you can do hair transplants. So basically you walk into a doctor's office and they set this big box on the doctor's office, and they finally get the appointment with him, and they sell him a business inside a business. They sell him a website that doesn't even have his work, because he didn't do hair transplant.
With great marketing.
With great marketing.
And probably before and after pictures of that the machine did.
Correct.
So look, these are before and after. I've seen amazing before and after pictures. And so they got some awesome result with some machine, some surgeon did with lots of experience, and then they used that picture to put in the office of your local cosmetic surgeon as, look at the before and after of this, smart machine.
That is correct. And they parlay that to, hey, you don't do anything. You don't do anything. Here's what we're going to do for you. We're going to have our marketing guy teach you how to do a pay-per-click campaign, because it's different in this market versus your plastics, your noses, and your breast augmentations. We're going to help you do a whole separate website that makes you look like you actually do this for a living, like you do this full time. And they're pretty good at it. They've come a long way. Then they're going to do is, once you get a surgery, they're going to send in a technician that, oh, by the way, does all the Hollywood stars in Beverly Hills. That's the pitch. So our technician's so good, they're filled up for the year. You can get them, bring them in for a surgery, and they'll pay them $1 a graft. It just goes on and on.
Yeah.
So you get the picture.
And the last one is kind of the same as what we were talking about. The clinic's not surgeon being the third term, or the third sign to look out for. That's kind of the snake oil sign, is just like this clinic. And the fourth sign to be aware of is these patented and trademark machines. And it's really good marketing. I mean, I remember the first surgeon that I saw in California that had his own trademarked machine that he invented that tied to his name, and it was very, very catchy, right? And since then, it's like everyone is coming out with these. There's way more money in selling a product than there is selling your time as a surgeon. So it seems like most of the top hair transplant clinics, or many of them, once they get any name whatsoever, they are now either going into we're selling this new product, which has my name attached to it, this new foam or new, or it could even be something that already exists, but now they just put their name on it. I've noticed that a lot in like Facebook ads and things. Or it is this new specialized, usually FUE punch. Now, why is there no new specialized FUT strip surgery machine? Well, because you can't do that with a machine, because it's a much more complicated surgery. So you can't sell it. So, and it also is just not nearly as pretty looking, It's a beautiful thing to just take this little punch and then just punch it back in, and like it's all good, versus like, I'm going to take out this strip of tissue out of the back of your head and then cut it up and then make a little bunch of incisions on the top of your head and implant it in. But hey, that's what I had done to me. And it turned out pretty good. So it's not quite as bad and nasty and horrible and the old technology that so many of these companies that sell the machines would like you to hear. So those are, I feel like, the top 4 snake oil signs that I just constantly see. And, they're so easy to buy into. And every time that I hear about a brand new one that pops up, I get kind of excited about it and interested in it, because people write me and go, oh, but did you hear about this thing? And I'm like, really interesting. Okay, I got to check this out. And then I look at it and it's the same thing. Hopefully this is helpful for you guys. And, Yeah, I'm sure you're going to make a great decision because you're watching these videos, becoming educated, and you are an educated consumer, so you're probably going to be an awesome consumer.